Welcome, everyone. We're just going to wait a couple more minutes to let some more people get on, and then we'll get started. All right. Hello, and welcome, everyone, to Services for Independent Living Mental Health webinar titled Coping and Self-Care Tips During COVID-19. This webinar has been brought to you by Services for Independent Living and the Ohio Department of Mental Health and Addiction Services / Northcoast Behavioral Center. Just some housekeeping rules for today. Participants will be muted. If you have any questions, please share them in the question box, and we will attempt to answer them at the end of this webinar. A recording of today's webinar will be available on our website at www.sil-ohio.org. Please feel free to download any or all attachments that we have available today by clicking the icon in the control panel. There will be a satisfaction survey emailed to you after this webinar, and it may even pop up right after the ending of it, so please fill it out. This is how we get our feedback on how we are doing. If you would like to receive CEU credit for attending today's webinar, please select yes on the satisfaction survey once you fill that out so that we can get that out to you. Now I want to introduce our speakers for today. We have Melissa Brown, who is the Rehabilitation Department Director over at Northcoast Behavioral Center, and we have Peer Support Specialist Jodie Bell also that will be presenting today. So I am going to switch everything over to Melissa. And Melissa, we are very happy to have you here today. Welcome.
Good morning, everyone. All right. Can you all hear me?
Yes, we can hear you and see you. You're all good. Go ahead.
All right, thank you. All right. Hello, everyone. I do want to thank Miss India for reaching out to the Ohio Department of Mental Health and Addiction Services and asking us to do this presentation today. I also want to thank Vicki Montesano and Dr. Trevino for asking me to facilitate it. I really feel privileged to be speaking with you today, just knowing that they trusted that I will be the right person for this training. I won't be facilitating this alone. I have some resilient people with me to deliver a message of hope and empowerment. Later in this presentation, you will hear from Northcoast Certified Peer Recovery Specialists, Vivian, Jodie, and Christian. Our learning objectives. We will be defining mental health, wellness, and self-care, describing the types of self-care. We'll also be providing you with some evidence-based tools and strategies to help you enhance and maintain your self-care. And we will also be providing you with some strategies to engage in during the COVID pandemic. And I am hoping that we will empower you to develop your individual self-care plan. Okay. Self-care is a topic that is near and dear to me, but something that I had to learn the hard way about the importance of self-care and taking care of yourself. Although I have a lot of degrees, I have a lot of credentials, I got a good job, I'm doing good, really well right now, it has not always been this way for me. I'm passionate about what I'm sharing because of my experience. See, I was forced to engage in self-care. That's right, I said forced. And I know people are probably saying, how in this day and age could someone be forced to engage in something as simple as self-care? So I say to you, you can choose to do self-care, or if you don't take care of yourself, there may be a situation that will force you to begin to take care of yourself. Because I am so passionate about self-care, I don't want to waste anyone's time. Therefore, I need to find out if this is the right training for you. So there's our first question. So how do you know if this is the right training for you? If you've ever felt tired of being everything for everyone else, this might be the right training for you. If you ever felt that you were at your breaking point, yeah, you're in the right room today. You ever felt that your back was against the wall? Or do you find yourself helping others and taking care of others more than you take care of yourself? Have you ever felt just tired of being sick and tired? Have you found yourself in some storms and you feel that it's just storm after storm after storm? Have you ever neglected yourself in order to make someone else happy? Yep, this might be the right training for you. Have you ever dreaded going to work, although you liked your job, you just felt so burnt out? Your desire to help other people and to fix everyone, it just starts to weigh on you. This might be the right training for you. If you ever felt that something was wrong in all of your relationships, like no one understood you, no one wanted to listen to you, and you started experiencing increased conflict, everything just seemed to be negative, this might be the right training for you. You know, have you started to feel like I'm getting sick more often? My blood pressure is getting high. I'm experiencing some acid reflux, some heartburn. I'm getting rashes. I'm frustrated. I'm irritable. I'm anxious. I can't concentrate. I'm starting to feel depressed. I'm starting to feel guilty, restless, self-esteem. So if you answered yes to any of those questions or situations that I just mentioned, this is the training for you. If you answered no, we're still going to let you stay because you might be the one everyone is trying to get away from, and you don't even know it. All right. So how did we, before I go to our next question, how did we do with our first poll question?
For the question that said, have you ever found yourself taking care of others more than you take care of yourself? 78% said yes, and 22% said sometimes. For the question of, have you ever felt that you were at your breaking point? 77% said yes, and 19% said sometimes.
Okay, well, that sounds like we're in the right place. All right, so here's something else that I do want you to think about. So this is, when was the last time you did something wonderful for yourself? You know, what did you do? Did you feel like your mental health influenced your decision to do something for yourself? All right. All right, so what is mental health and why is it so important to us? So mental health can be defined as a state of well-being in which each of us are able to realize our own potential, cope with the normal stresses of life, work, and contribute to our community. Mental health provides us with the capacity for rational thinking, communication skills, learning, emotional growth, resilience, and self-esteem. Resilience is that characteristic of our mental health that is associated with our ability to bounce back after facing tragedies, loss, trauma, or even severe stress. Resilience is like that skill, that gift, that capacity, that knack that we have to secure the resources that we need to support our well-being. Our well-being, it's characterized by our ability to function in response to some routine stress, anxiety, changes, or distress. So as you look at the attributes of mental health, it's not surprising at all to see that self-care does affect our mental health. So, what is self-care? The World Health Organization's definition includes the ability of individuals, families, and communities to promote health, prevent disease, to maintain health, and cope with illnesses and disabilities with or without the support of a healthcare provider. Self-care can also be defined as that intentional time, the time that you take to yourself, that time that your me time, the time for you to nurture yourself physically, mentally, spiritually, and emotionally daily. I did say daily. I didn't say once a week, once a month, quarterly, or annually. Yes, it's daily. Self-care is not about acting selfish. Instead, healthy self-care is taking time, just taking time for you, taking time for yourself that includes your body, mind, and spirit. Self-care can include our activities, some hobbies, or even some practices that we purposefully engage in on a regular basis to help us enhance our overall health and our well-being. So there are several types of self-care. One of those types is emotional self-care. Emotional self-care includes identifying and accepting and expressing a range of feelings, which is vital to our health. It is suggested that we find outlets for our feelings. This will definitely help us with our emotional self-care. This could be anything from, finding something to do to relax, just sitting in a nice quiet place for you. When you're thinking about your emotional self-care, thinking about like relaxation techniques. What do you do to relax? When you are doing well with your self-care, your emotional self-care, you really can identify and express and manage your feelings. Another thing that you can do, when you think about your emotional self-care, just create a calming place for yourself. Just get like a mental mantra or something. I know when I become stressed, one of the things that I say all the time is, this too shall pass. And that seems to work for me. So sometimes if you're feeling overwhelmed, you got to ask yourself, why are you feeling overwhelmed? And don't be afraid to ask for help. Delegate. Sometimes you just got to delegate and let it be. But most importantly, if you're having a difficult time with your emotional self-care, do not be afraid to seek personal or professional assistance. Okay. Financial self-care. Some people may not think there's a correlation between self-care and your finances. I beg to differ because I think being broke is stressful. Financial stress, debt, living paycheck to paycheck will stress you out. I have personally had that experience. It is not a good experience. It is somewhere where I hope I am never back to that place again. And this is why it's so important to get yourself a budget. You know, be intentional with your money. Try paying off your debt. Don't be afraid to live within your means. You know, try to save money. Learn how to invest your money. You know, this will, if you, try to save money, learn how to invest your money, be intentional with your money, eventually you can build some wealth over time. Okay. And eventually, your money will work for you and you won't have that financial stress. So physical self-care, this, basically involves that active, just being active, moving around, eating and taking care of yourself, just, kind of moving your body, getting some fitness in, but it's also listening to your body and understanding, we definitely know when our body is telling us when we're hungry or even when we're full, but listening to our body and just remembering, is it time for a checkup? Have you got your annual checkup? Are you doing your preventative care? Or if you think you are sick, you just might be sick. And then there's that personal, I include relationship self-care also when I'm talking about the personal and relationships. This is that self-care that you want to connect with people. You do want to set aside some time to, connect with some people, but you want to limit your exposure to those people who drain your energy, but leave you feeling exhausted. It's okay to politely decline some activities, especially if you think it's going to be a negative environment or it's with people who induce negativity on you. Be mindful of the words that you use with others and the impact that they may have. Never miss the opportunity to tell those you love how much you care about them. Learn to speak your truth with grace. Holding things in can take us back to that, not effectively dealing with our emotions. So learn to speak your truth. And sometimes we got to weed out some toxic people. But when you're weeding out toxic people and you're trying to be a good friend, just let people know that you're requesting the same. Spiritual self-care is that ongoing search for meaning and understanding in life. It's exploring those, it's like expressing our beliefs and our values. Spiritual self-care has a lot to do with our beliefs and our values. Where does our integrity coming from? And it just helps us understand, our purpose here in life. But one of the main important things that I like to tell people about spiritual self-care, just making sure that you forgive people often. Open up your heart, because when you carry that on you, it can be very hard to carry not when you're not forgiving someone. Also, reading poetry or inspirational stories, having you an inspirational quote, that could also help with your spiritual self-care. And I know for me, I like to write down my values and just engage in some activities, whether it's church, hearing a good sermon, or just listening to some good, some good spiritual music when I'm driving to work. This really helps me in my day. And I just also ask you, with spiritual self-care, that you consider, some type of daily spiritual practice. It could be a devotional reading, it could be anything. And then there's the professional self-care. So you definitely want to make sure that you are taking care of yourself. When you're at lunch, make sure you take a lunch break. When you get time off for holidays, rest and enjoy yourself. Learn how to say no. It's okay. Set boundaries. You can say no. But with your professional self-care, I do challenge you, set some goals. Do something different. Take a class or 2 or 3. Go get that degree that you've been thinking about. You've been telling yourself that you're going to go back to school, because you want a better job. Go ahead, do that. Set some goals for yourself. So I just, gave a small definition of self-care and just talked about some types of self-care. But right now, I want to take a time out and let you hear from our peer support specialists here at Northcoast. They are going to give you a message about self-care, and I hope that you can receive these messages.
Hi, my name is Vivian Olson. I'm one of the Ohio Certified Peer Recovery Supporters here at Northcoast Behavioral Healthcare. I kind of have a wild kind of ride, but just to sum it up, from the age of 13 to like 33, there was about 23 years there from 1978 to 2001 that I spent more of my life in a psychiatric hospital than out, because there was really no medication that was helping. When I was here at Northcoast as a forensic patient, they invented the right antipsychotic that ended up helping me, got me on the right combination of a mood stabilizer and something for my obsessive compulsive disorder. And that's when I say my recovery began, back in 2001. Since that time, I have not found it necessary to pick up a drink or use drugs. That's going to be close to 19 years in December 29th. It'll be 19 years, God willing. And 11 years ago, I quit smoking cigarettes. I joined Nicotine Anonymous when I got discharged from here in 2007. I was a patient here, a forensic patient, for 10 and a half years. I was found not guilty by reason of insanity. And I thank God that they sent me here for treatment instead of prison, because really the fact of the matter is, if they would have sent me to prison, I wouldn't have gotten no better. If they would have let me out, I probably would have just done the same thing. I do still suffer from obsessive thoughts to hurt myself and others. The only difference is I haven't acted on it since 2004 when I was a patient here. I work closely with my psychologist, so if I get to a point where I think I can't control my actions or whatever, I go to a crisis center. I get help right away. I don't try to hide it like I used to. I used to try to hide it or hope and pray it went away on its own. But inevitably, if I'm getting sick again, it's only going to get worse. So I just emphasize to the patients here, especially the forensic patients that I primarily work with, that it's really, I know you don't want to go to the hospital if you're getting sick again, but it really might be the best thing for you in order to prevent another crime from happening or preventing anything from happening that we often regret later. While I was a patient here, I was working in the patient work program. I worked in the storeroom for the last 2.5 years I was here. And when I got discharged in 2007, I was able to apply for the storeroom position. I took the civil service exam and scored very high, so they hired me for that for 4.5 years. While I worked in the storeroom in the warehouse section of the hospital, I was volunteering in the SAMI department here. This is also where I got my certification for chemical dependency counselor assistant. I was working in the SAMI department 4 hours a week for 4.5 years. All the time I was working in the storeroom. Towards the end of working in the storeroom, the CEO came up to me back in, what would that be, back in 2010 or something, 2011. And he wanted me to start peer support here. They didn't have a program and he wanted me to start it. I really thought the job I was doing in the storeroom was helping me stay stable. I really didn't understand that I had actually got recovery at that moment. And he had seen something in me that I didn't even see. So I said, no, thanks, but no thanks. I'm content where I'm at, just volunteering in the SAMI department. I was continuing to do the Dual Recovery Anonymous meeting that I've been doing here since 2004. I started that as a patient, did it for 3 years as a patient, about eight or 10 years as a volunteer. In the last 3 or 4 years, I'm a paid peer support specialist helping out with the Dual Recovery Anonymous meeting. However, it really is a patient-run meeting primarily. So about 6 months after I told the CEO I was happy where I was at, because I was a temporary part-time employee, when they consolidated the Cleveland campus with the Northfield campus, I lost my job. So it was kind of like, hey, you still got that available? It's looking pretty good right now. Good right now since I don't have a job at all. So, but I really realized that's where God wanted me all along. I mean, that is where I needed to be. The first year, I was the only peer support specialist here. I did all client rights. I helped the client rights specialist. When people were first admitted, within the first 24 to 72 hours, you go over their client rights, depending on the reason they're here, if they're forensic or civil or whatever. And then after that year, I was kind of burned out from it. Sometimes I would come on a Monday morning and I would have 32 people to see. And I was only working 20 hours a week back then. So it was kind of a lot. So when my supervisor said, Joy Chapman, the client rights specialist, said she was going to start hiring more peer support specialists, I told her, I said, you know where I feel the best spiritual high? You know where I really feel I'm making a difference is doing the groups, doing the SAMI groups, the DRA group stuff. I said, can I go to doing groups full time if you get more people in here to do the client rights? And she was very accepting of that. And she told me to go around to the units and arrange with the clinical nurse managers to get a schedule together. So I've been doing the peer support here for the last 9 years. We went from just me being here to there's 5 of us in the peer support program. I primarily right now work with the restoration and competency guys, the people that are charged with the crime, but for whatever reason, they're not deemed able right now to help their lawyer in their own self-defense. So on them 2 units, the RTC units, I do a SAMI group each week, substance abuse and mental illness. I explain to them that that's one of the reasons why I'm able to stay out of hospital and stay stable is because I haven't used drugs or alcohol for 19 years, because there's enough going on with your mental illness that you don't need to combat, make it worse with alcohol and drugs. What I do here at the hospital for self-care, first and foremost, I always take a lunch. I know a lot of people don't take lunches. They say they got too much to do. I make sure I take a lunch. I get in my car. We're only 3 miles away from the beautiful Bedford Reservation in the Cuyahoga Valley National Recreation Area. I go there. I bring my lawn chair. It's in my trunk of my car. I get out my chair. I sit in the summertime. I sit in a shady spot near the woods. And now I'm sitting in part of the woods where I can see all the way through, so I can see the other people on mountain bikes going through the trails. And then when it's rained real hard, I like to go where there's what they call a gorge around here, Tinker's Creek. And I just love to hear the rushing of the water. So that really helps me refresh and refocus each day. When I go to nature, I always make sure no matter where I'm at, I'm outside at some point during the day, at least 5-7 times a day. I got to be outside with nature. That's one of my main coping skills is being outside. And at home, I have a lawn chair. Even in the wintertime, I go sit out on the lawn chair on the patio in the wintertime. I do not need to smoke anymore when I'm sitting out there, but I still enjoy it. Other things I like to do, I make sure every day I get 2 to 4 pages of Bible reading in. That helps me stay centered as well. I always do my homework for my doctor every day, which I think that is good for my mental health, self-care, because whatever went on that day, I get it out, get it on the paper, and then when I see him every 3 weeks, we discuss what I wrote out in my homework. I also exercise every day. For a while, I wasn't able to exercise hardly at all because I just recently, well, kind of recently, in the last 2 years, I had 2 total knee replacements. So now I'm just finally getting back to walking again, riding a bike again, riding a stationary bike again. I'm in touch with an exercise physiologist that's helping me try to kind of kickstart my metabolism because I've been at the same weight for the last 3 years ever since I started having problems with my knees real bad. So that was and the other main thing I do is I like to go to Mass each week. We started going to Mass at the Catholic Mass, and I go to the Adoration Chapel each Sunday from 3 to 4, and that's my prayer hour. That's where I go and dedicate an hour of prayer and intercession for others. So I just make sure that I try to stay well-rounded. I take care of myself because if I don't take care of myself, I can't take care of anybody else.
Hey, what's up, guys? My name is Christian and I am a peer recovery supporter at Northcoast Behavioral Healthcare. And I was asked here to talk to you guys about what I do for self-care. Now, for me, I'm a busybody. I like to be doing things at all times. I'm a videographer as well as I am a working musician. So a lot of times the things that I'm doing are quite busy. I like to be able to go out, hit the streets with my camera, or be playing in a band at one of the many venues that I play at. And that's just the things that I'm passionate about. For me, self-care is about getting back to my passions because these things were robbed of me for so long when I was in my addiction. I wasn't able to have a nice video camera. I wasn't able to have the equipment or the just ability to go out and play shows because I just, plain and simple, I just didn't have it. So once I was able to find recovery, once I was able to start being able to get my life on track, I was able to start doing the things that I was passionate about again. For me, it was really, really difficult. It was really difficult to be one of those people that was like just sitting around trying to do self-care. I watched a lot of the videos. I watched a lot of the things that a lot of other people did. And for me, like kicking back, sitting on the couch, watching Netflix, maybe like trying to do like small arts and crafts, that stuff didn't work for me. It's like I have to be moving constantly just for me to be able to feel like I'm doing something, for me to feel revitalized about what I'm doing. So for me, I still today, I play with a band. I play actually in 2 bands. I just released 2 new records. I just put out a few feature music videos that I shot for local bands. These are the things that make me feel revitalized. These are the things that give me the motivation to go to work because I know if I go to work and I'm able to make money, I'm able to invest that time into these projects that I love doing. It's like, that's my self-care. Like, and for most people, they're not, they're like, man, you need to chill back, sit back, relax a little bit. But it's like, I love moving. I love being able to go out and do things and like to be able to get into my passions. So my advice to you guys is that it's like, whatever you're passionate about, it's like, make sure that it's a part of your self-care. Make sure that you're getting to the things that you love to do. I know for me today, as soon as I get off work, I have my camera in my car and I'm going to go out tonight and I'm going to be shooting some skyline footage of Cleveland. I'm shooting a video right now. And that's the things I'm excited about. It's like, I want to be excited about caring for myself. I want to be excited about the things that I'm doing in my life outside of work. It's like, so if you think that you can find the way to get to the things that you're passionate about, I think it will help you in your self-care going forward. That's all I got for you guys. Thank you.
Well, my name is Jodie Bell, and I am Ohio Mental Health and Addiction Services Peer Recovery Supporter for the Northcoast Behavioral Healthcare. I joined the peer support team back in 2017, and I have been having probably a very, very meaningful and purposeful time in my own journey of wellness and recovery, being here at Northcoast and working with civil and forensic patients. I have been a peer recovery supporter for probably almost 17 years for the state of Ohio in various public service um, agencies. I've been with NAMI over 15 years, NAMI Ohio, as their state peer-to-peer trainer and educational mentor and facilitator. Then I started my own peer support practice. Purely Yours LLC has been in business since 2013, and I am so proud that through all of those years, I just never gave up. And this December, God willing, December the 10th, would be 29 years of the journey from homelessness, hopelessness, helplessness, and just broken. And to be able to look at myself in the mirror and to see who I've become, and to be able to have a voice today, to be able to go into these groups at the hospital here in Northcoast and to see myself in so many of the patients. As they say in the saying, you teach once, but you learn twice. And I tell you, I have double dipped for the last 3+ years here at Northcoast in learning so much about my own personal healing, which has brought me to self-care. It is so important for me to continue to have one of the most important relationships that you can ever have is with yourself. And I've learned to be my own best friend, because if I can't have on a relationship with myself that enhances my own vitality, that enhances my own ability to be able to see the world through eyes of a colorful lens instead of black and white, then I will be right back to where I was before. So self-care for me is not an option. It is an absolute. I do daily meditations, and I have a wonderful relationship with my canine friend, Isabella. She's a Maltese mix, and she was a rescue. And she has taught me so much about giving, because she demands my attention. And I respect that about her, is because she has helped me to learn is that getting outside of myself and learning to be there for others the way they need me to be there for them has helped me to be so selfless. So I understand her, she understands me. And once again, another one of those learning lessons of self-care. Another thing that I do and I must do because of having a desire to wanting to work and to be at a level of functioning that I needed to be, I was not able to be as hands-on because of the grave side effects that I was having with the medication. I pride myself on complementary alternatives for my self-care and getting my monthly acupuncture, my monthly massages, and my monthly chiropractic. Eating better, daily exercise, and having a healthy, wholesome distraction of good music. And my favorite fun time is tea time. And that is probably one of my favorite joys is tea parties, tea time with friends. And so maybe one day I'm able to enjoy some time with you and you can enjoy some time with me. Come and have tea time with you.
So I just want to thank Vivian, Christian, and Jodie, and then just let you know I get to come to work every day to work with the best peer support specialists. Vivian is not here today because Vivian is doing a group with patients at this time, and she did not, because of her commitment to patient engagement and doing for the patients what she said she would do, she couldn't be on with us right now. She had a group that she wanted to do. But so I do thank them for those, their stories about self-care, but I hope that you heard, something that you could use, or that you heard something to make you think about your self-care. So, your next questions are, what's holding you back from engaging in self-care? Or, what's distracting you from taking care of yourself? So let me know how we're doing on that poll question.
So you have 65% says time, 12% money, 4% knowledge, and 20% family responsibilities.
All right. Well, you know what? Those are the things that we usually hear when we talk about self-care. When you ask people the reasons they think that they are not engaging in self-care. So here's what I want to say to you. If you have 5 minutes, I have some evidence-based strategies that you may find useful in a variety of stressful situations. Practicing relaxation techniques, they can be beneficial. For one, they can reduce our heart rate and our breathing rate. They can slow us down. They can decrease our blood pressure, just also improve the, our oxygenation to our muscles. So the very first technique that I want to talk to you about is not on the screen, but it's free. Deep breathing. Deep breathing is the most common relaxation technique used in the United States today. It's simple, it's easy, and it can also be a quick fix to help you calm down when your anxiety increases or you need to take a moment for yourself. So for those who don't have time, you know what? When we're done here today, take a few minutes, sit down and give yourself a chance to deep breathe. Meditation. Meditation is a strategy that trains the mind to develop a greater sense of calm and insight into one's experience. Meditation can help people reach their deeper inner resources, for healing, just to calm your mind. And just, when your mind is calm, it does help us function more efficiently. With meditation, you allow your mind to quiet and focus on your deep breathing. Meditation can also release those endorphins that might have that calming effect on your mind, your body, and your spirit. Mindfulness it's like a form of meditation. With mindfulness, like several areas of your brain is activated, and it makes you more aware of, your bodily sensations and, just having an increased sense of yourself. It helps us focus on what's happening around us. Being mindful includes being in the moment, paying attention to what's going on around you, what you're seeing, what you're feeling and hearing. Exercise. Exercise can get us moving, get that body flowing. And we've heard for so long, if you just move, if you just walk 30 minutes a day, 5 times a week. 30 minutes a day, 5 times a week. I've heard that so many times. So some of the things that I've done is parked my car further, especially if I'm going to the grocery store or even at work. But, I'm at a place where I can do a lot of walking. But for people who don't work at a place where you can do a lot of walking, use that walking when you go to the grocery store. Yoga. Yoga is trending right now. Well, yoga's been trending for a long time, but yoga has really been trending right now. Some people see it as a form of exercise, just letting them relax and get flexible. And just also being in that moment. Also being in that moment with your body. Self-talk is also a strategy that you can use. How do you turn your negative thoughts into positive thoughts? Developing some affirmations. What do you want to do? Just talking to yourself, reminding yourself of the things that you want to do. And sometimes we got to remind ourselves of our potential, or remind ourselves of where we've been and where we don't want to go back to. But with that self-talk, it deals a lot about taking that negative thought, taking those negative thoughts and making them into positive thoughts. And lavender oil. I can remember the first time that I did a presentation about lavender oil. When I was doing my research, I came across a study where there were some students who, some of the students used lavender oil and some of them didn't right before they took the test. And the research said that the students who used the lavender oil did much better on the test than those who didn't. So lavender oil can make you relax. One of the things that I also learned recently about lavender oil is, while we're in this season of mask, I was in a meeting and one of the ladies mentioned just putting a little drop of lavender oil in your mask, and see how that can improve your day. A lot of these resources can also be found on YouTube. I wanted to share some videos, but we can't share YouTube videos anymore. So I do want you to look up the Wellness Project. And if you also have time, there are some 5-minute meditation videos also on YouTube. And for those of us who have smartphones, there's some meditation apps on the phones that you can use. All right. I just want to ask, have you ever been passionate about something? People, they often say, if you want to find your purpose, find your passion. So if your answer included something like, oh, I don't feel passionate about anything, you might be saying to yourself, I need to figure out what my passion is. What am I supposed to be doing? So I just want you to think about, what would your life look like if all of a sudden you became passionate about your self-care? So when you engage in self-care, you can see the hope and faith in your situation. You know, when life starts throwing things at you, you know what? You'll throw them back. You'll build that sense of self-confidence. You'll be able to enhance your ability to deal with those challenges. You know, have that sense of peace. You know, you become aware of your personal vulnerabilities. You know, you start telling yourself, I can't do the things that I used to do. I can't be around the people that I used to be around with. I'm okay being by myself. You start to lead with integrity and dignity. You taking care of yourself. You don't have time for nothing else. You don't have time for those negative things. You're making better choices. You're avoiding those risky behaviors. So when you're taking care of yourself, you're ultimately improving your quality of life.
Melissa, I just want to let you know we have 2 minutes left. So I just want you to, know that.
All right, my 2-minute warning. All right. So I just want to talk to you real quick. We also had another YouTube video. Couldn't really do the video, you know, it was another YouTube video, but I do want to tell you right now, we do have COVID, you know, we're dealing with this COVID-19. But again, I want you to look at COVID-19. Let's let this be your season of self-care. You know, focus on controlling the things that you can, open up, sharing your feelings, practicing some daily stress reduction tactics, you know, your physical activity, engage in mindfulness. But look at this, it says cope COVID. And this came from a nurse and it was a great video, but if you just think cope COVID, counting your blessings, you know, getting rid of that those negative thoughts, volunteering, helping, and also doing your part not to spread the virus. All right, so, you know, we talked about all of this information. I do have some handouts for you to develop a self-care plan. Those handouts will be available, but since I only got 1 minute left, I do want to just end, and I just ask you to imagine for a moment what it would be like the next time you made a mistake or overreacted or felt challenged. You know, you could respond with, when you engage in a self-care, you respond with self-compassion instead of self-criticism. You can respond with self-determination instead of self-doubt, self-love instead of self-hate, you know, self-assured instead of self-defeating, you know, self-composed, self-development instead of self-isolation, you know. And also with self-care, you know your self-worth. So you are not just going to let anyone treat you any kind of way or just do any kind of thing. And lastly, self-care is exactly what it sounds like: caring for yourself, taking charge of your health and wellness, and just you know, living a healthy life. And developing a self-care plan, I'm going to give you the tools to do that, will help you achieve that potential. All right.
All right, Melissa, that was an awesome presentation. I just want to thank you and your peer support specialist for agreeing to come on and educate us about how important self-care is. I just want everybody to remember that you are a very important person, so take care with self-care. And if not you, then who? And if not now, when? So just think about those things. If you have any questions, right now we're ending, so I will make sure that in the follow-up email that you get Melissa's information so you can ask her directly. Remember that the handouts are available for download in the handout section. And if you need CEU credits for attending today's webinar, please specify so when you fill out the survey. Thanks everybody again. Thank you, Melissa. And I hope everybody has a great day, and remember to take care of themselves. Thank you.